To start out, some of the first DSOs made a bad name for DSOs because there are two ways they can make money. One is they try to get a healthier bottom line out of the individual office, and then two, they try to couple that with adding lots of offices. When you try to squeeze an office to get more out in the bottom line, that can be a very uncomfortable process for dentists who are working in their office. Sometimes it's directly related to doctor pay, and they'll reduce sometimes drastically what they pay their doctors, and that makes life uncomfortable for people who are operating in that office. Yes, it might create a healthier bottom line, but at the expense of high doctor turnover, and that's not a good scenario. Another thing to consider is the amount of sort of infringement on the practice of dentistry, or in this case we're talking about a dental group. So a doctor needs to have a certain amount of autonomy over the care that they provide to their patients. And if you get too many business guys interfering with what a doctor thinks is in the best interest of their patients, that also paints a bad picture. And so as a doctor who's considering partnering their practice with a larger group, it's important that they understand what that relationship is going to look like. It's important that they understand what are their requirements moving forward. Are they going to be required to switch from a certain system or products or materials that they've learned to like and love? Are they going to have to switch to something that they feel isn't as good, just to save a buck? One of the great things about specialty dental brands is they'll repeat that mantra over and over again, that they don't care what systems you use. We have doctors using the most expensive materials and systems out there. They'll look for ways to save on the cost of those materials, so they'll pool together the resource. Say they've got, if they've got 20 offices that all want to use this one system that's expensive, that's fine. They'll just pool those together and then go to that manufacturer and try to get a better price on it. But they're never going to dictate to a doctor that they use a different material and interfere with the doctor's autonomy and choices in that way.